first understood that I had fibroids like 17 years ago, I had a miscarriage, and I went to the doctor to get treated for that, and they mentioned to me, oh, you have fibroids, and I asked them what that was. They were like, don't worry, it's not a big deal, and, it's nothing, really. Okay, so that was that, and then really I didn't come to understand how they were affecting and impacting my life until maybe like 5 years ago. I was having a lot of heavy bleeding, and I went to the doctor, and they told me, the reason you're having so much bleeding is because you have a lot of fibroid tumors. So I was like, well, what can I do about it? They were like, well, you can either do nothing and wait till you get in menopause, or you can get a hysterectomy. And I just felt like that was such a drastic option. Fibroids impacted my lifestyle probably the most over the last 5 years. I just have had continuous heavy bleeding. I mean, really heavy bleeding with a lot of clotting, and always thinking ahead, making sure that I had a change of clothes, or that I always had extra pads and tampons, because I never felt that I knew when I would start bleeding again. Cramping, even in my personal life, like maybe my intimate life, not even wanting to have sex because feeling like, oh my God, I'm going to start bleeding, or I'm going to have cramps. So it did make an impact. Plus being anemic, I was like super tired, and I just didn't really understand why I was so tired, but now I know why. The care I received before, during, and after my procedure with UFE was, well, when I first got to the office, I had a lot of questions. I felt that Dr. Taheri addressed my questions. He seemed very caring, him and his staff. They never looked at me like rolling their eyes like, oh my God, what a stupid question, or why are you asking me that, or that's so common sense, like why? But he gave me good options right away. He said, you know what, you can be taking all the iron that they can give you, but unless we stop the bleeding and get you treated, you're gonna stay anemic, and you're not gonna get well. So I felt that was like the first, like I felt that there was light, like he was caring, and he didn't just say, oh well, take some iron pills and go home, and we'll call you in a few weeks and see what's up. He was like, okay, we need to stop the bleeding. He gave me medication right away to pick up. He goes, I want you to go get it immediately. Start taking it. Your bleeding will stop within 24 to 48 hours. And I stayed on that medication for probably maybe 6 weeks. Then I was put on birth control pills to control the bleeding, and given the different options. Well, before we do the surgery, because in addition to having fibroids in the lining of my uterus, I also had them in my uterus. So that made my treatment a little different. Whereas the UFE wasn't the only thing I had to do, I also had to get the fibroids out. So he said, well, we could do different things. We can give you birth control pills to control the bleeding, do the UFE, and then after the UFE we can take the tumors out, or we can give you a medication, Lupron, that will put you into menopause, shrink them down for like 3-4 months. Then I thought about the two options. I felt that this was like in September. I thought, you know what, I want to start the new year free and right. I don't want to take medication for 3 months to shrink them and then get my UFE and then see what happens from there. I'd rather take the UFE now, after a few weeks, have them take out the tumor, so by the end of the year, we'll be finished and I'll be having some relief from this. So that was my only choice in the matter. But other than that, I feel that he gave me different options. He didn't just say, okay, we're going to go in and you're going to take this medication and we're going to wait, and we're going to, he's like, we could do this or we can do this. What do you want to do? I would call him up at different times and say, Dr. Terry, I'm really sorry to bother you, but I'm wondering about this. And he would always go, oh, no problem, I'm glad you called me. I want to address your concerns, I want you to get well and so forth. So I never felt like I was an annoyance, or like my questions wouldn't be answered, like, oh my gosh, like what do you want now, So that I think the care was good. The difference in my life before my UFE treatment and now is that I feel like I've been freed. I feel like I don't have to be stressing all the time about bleeding at the worst possible time. I can just be myself. I don't have to wear a panty liner. I don't wear panty liners anymore. I used to always have a pack in my purse or always have one on just in case. And I never take a change of clothes with me anymore. I don't feel that I'm going to start bleeding spontaneously at any given moment. I feel cleaner. I feel like I could be more spontaneous in my life, in my sex life. I don't have to worry, oh my God, I'm going to start bleeding. When my period's supposed to come, it comes. I don't have bleeding in between my periods. So that's been a major lifestyle change, and it's been, I don't know, it's given me more confidence because I don't have to be worrying about all of a sudden I'm going to start bleeding. And that was the worst part of it, really. My experience with Dr. Taheri, I can't say enough wonderful things about him. He's been very kind, very polite. His staff also at the Glendale office, very nice, very professional. I feel that he's done everything he can to find out exactly what was wrong with me, checking to make sure he really understood, since like I said, my fibroid were not just in the lining but also inside the uterus, to make sure he knew how big they were, where they were at, so that he could let me know exactly what was going on, because I didn't even realize I had a fibroid inside my uterus that was so big. And so definitely professional, always caring, always made time for me, never made me feel that I was an annoyance or a pest, or just like next, like a cattle call, you know, where's the next patient, where's the next patient, or your 5 minutes are over, you need to scoot along and I got to see the next person. I never felt like that. I always felt that Dr. Taheri made time for me, very professional, very caring. If I knew someone with fibroids, I would definitely recommend him to see Dr. Taheri, because I feel that he's on top of he knows his stuff. I mean, maybe I'm wrong on this end because of where I've come from in my experience of, I'm not a doctor, obviously, but learning about UFE, I feel like, you know, he's kind of cutting edge. He knows his stuff. He's going to give you the best treatment, and he works with top-notch doctors to make sure that your experience is going to be pleasant. He covered all the bases as far as, even though, you know, it was painful, pain medication, after treatment care, during treatment care, making sure you're ready for your UFE, that he's not like in a big hurry to hurry up. Let's hurry up and get the UFE done. I want to wait a few more weeks until this happens. I want to wait till this happens. So he wasn't like pushing me, hurry up, let's do it. And I like that too, because I like to know what you're going to do to me, and I need a little time to digest it and think about it too, and I never got that feeling from him. So I think he's a definite professional. I would recommend people to come and see him. He works with your insurance, so it's not all about the money, you know what I mean? Well, if you don't got money, well, too bad, I'm not going to treat you. So I think that was an important point too, that I thought from his office. It wasn't about, well, your insurance isn't going to cover this, so therefore you better go find someone else to take care of you. We'll help you. We'll work with you. So I would definitely recommend him to another person, another woman who I knew who was seeking relief from fibroid tumors and would be thinking that UFE could be an option for them.